Hi, my name is Sandy Benhart, and I am one of the two outreach coordinators at the Teachers Retirement System. What I'd like to talk about here is the health insurance programs that we have to offer for retirees. The first one is TRIP, the Teachers Retirement Insurance Program, and that's the one that you're eligible for until you reach Medicare age, at which time you would move to the TRAIL program. So we will talk about how each of these programs work and how you would move from one to the next. In order to qualify for the TRIP program, you do need to have at least 8 years of service credit with TRS. So if you are someone that retired reciprocally and had a lot of years with maybe IMRF or SERS, and then just a few years with TRS, you may not qualify. You need to have at least 8 years of service credit, specifically with TRS. So once you meet that criteria and you are retired, meaning collecting a pension, you can select from several different insurance companies. The carriers are based on your county of residence, and you would have HMOs, open access plans, or the PPO available to you. The TRIP program is going to work as your primary medical and prescription drug until you reach the age of 65, at which time you would move to Medicare. And then the Medicare Advantage program, or TRAIL, becomes available. So again, this does include prescription drug, but TRIP and TRAIL as well do not include vision and dental. There are different opportunities to enroll in these programs. A lot of times, new retirees enroll in TRIP when their employer coverage terminates. So that could be anywhere from the end of the month that they retire up until as much as 4 months later. So they can enroll then, but you don't need to enroll right when you retire. Maybe you have another job, or you're married and your spouse is still working and you're able to hop on their insurance. And then they retire or you leave that job. That creates another opportunity to enroll in TRIP. So that would be termination of other health insurance. You can sign up then. Also, it's possible to not be on TRIP at all, but when you reach Medicare age, you could enroll in TRAIL. So enrolling in Medicare is an opportunity. And then the last one is coverage can be changed or started during open enrollment. So for TRIP each year, open enrollment is the month of May and coverage is effective July 1st. For TRAIL, open enrollment is mid-October to mid-November with effective date of January 1st. Many times, people would have other coverage and maybe they're not happy with that, or maybe they're on TRIP and they want to switch programs. They can use open enrollment as an opportunity to make that kind of a change. Any of these opportunities are fine. It's important to understand who administers TRIP and TRAIL because there are multiple parties involved. So TRS has a couple roles in this. First off, we are going to determine eligibility for the program, meaning we will be sure that you are retired and collecting a pension, and be sure that you had at least 8 years of service credit with TRS. And we are also going to withhold monthly premiums from your pension payment in order to pay for it. But Central Management Services, or CMS, is really the plan administrator. So they are the ones that evaluate and contract with the different insurance companies and work on the rating, what the cost will be, the premiums for this. So that is the role of Central Management Systems. And then My Benefits Service Center is a vendor that we contract with, and they are the ones that are going to handle enrollment and some changes to your plan throughout the time that you are on TRIP or TRAIL. Now, one thing to note is that the premiums can change as much as 5%. The overall program can increase as much as 5% each year, and that would be effective July 1st for TRIP and January 1st for trail. So let's talk about TRIP first. Let's say that you are enrolling in health insurance and are not yet eligible for Medicare. So the TRS member is going to be the benefit recipient. If you are married and covering a spouse, they would be dependent. And if you are covering your children under the age of 26, they would also be dependent. Most of the time, people that are enrolling in TRIP are not yet Medicare eligible. So they would fall into this not Medicare primary 26 to 64 category. Currently, the rates for either an open access or an HMO, those are called managed care plans, would be $330 a month for the TRS member. If you want to enroll in the PPO, it's $771 a month. And then below, if you are adding a spouse, you would see that the managed care for them, if you're on the HMO or the open access, they would have to be on the same type of program. That would be an additional $1,322 for a spouse and an additional $425 for each child. If you're on the PPO, you're at this $771, an additional $1,543 for a spouse, and an additional $552 for each child. Now, there is a category there that says when managed care is not available in your county. So when does that apply? Well, when you are living in Illinois, there are both HMO and open access plans in every county. They vary by county, but they are available in every county. If you live in another state, though, the HMOs are not going to be available unless you border right on Illinois, but the open access plan may be available, and that's going to depend on what county you live in another state. So there is an option possibly to be on a managed care plan even if you don't live in Illinois, and the premium would still be that $330 a month. But if there is no managed care plan available to you in the county that you live in, then you would have an option for the PPO at half the regular cost. So for the TRS member, the PPO is $771 a month. If you live in another state and there is no managed care plan at all available to you, then you can get the PPO for half price, or $385 a month. You will see, though, that that discount or reduced premium for living out of state does not apply if you have a spouse or a child. They are still going to be paying that same premium. So that when managed care is not available in your county will be only if that open access plan is not available in the county that you live in. And the way you would find out whether or not it's available is to go to the TRS website. And if you go to the member tab, you do not even need to log into your TRS account. It's on the member tab, and put in whether you're tier 1 or tier 2 and health insurance. And you will see TRIP for out-of-state accessibility. And then you can go to whatever state you live in and look in whatever county you live in and see what the options are. So that is how that would work if you live somewhere outside of Illinois. But again, if you live in Illinois, all of these plans are going to be available to you. So let's say that you're on TRIP, but now you are becoming Medicare eligible. There's a couple different scenarios that we're going to look at here. One scenario is the simpler one, and this is that you, the TRS member, are the only person on the health insurance, or you're using Medicare eligibility as the first time that you're going to enroll. So it would be that, or you and any dependents that you have are already on Medicare. So scenario one is that anybody that is going to be on the program is Medicare eligible. So how do you make this happen? Well, First off, you have to sign up for Medicare Parts A and B, and that is going to be through Medicare, which is part of Social Security. So within the 90 days prior to the month that you turn 65, you will sign up for Medicare A and B at ssa.gov and then go to the Medicare tab there. Once you get your Medicare card, you will send a copy of that to TRS. We will scan that in for you, and then you would contact My Benefits Service Center at this phone number here and officially opt to take part in the Medicare Advantage program, which is called Trail. And the premiums for that are going to be $2.16 a month right now for you. And if you have a dependent on there, $6.49 a month for them. So what happens with this Medicare Advantage plan is that you have Medicare A and B in place, basically underlying this. Medicare Part A is hospitalization and it's free. Medicare Part B is medical and it does come with a cost. Medicare will tell you how much that is, and you will take all of that, signing up for it and paying the part for Part B. That will all be through Medicare. Those two together cover about 80% of what you need, and then you need something overlaying that to cover. And this Medicare Advantage plan, which is an Aetna PPO, is going to take care of that for you. So what would happen once you're on Trail, that's this program, you will have an Aetna card. You would take that to your provider. They will take care of the premiums for settling the claims for that, and then they deal with Medicare separately behind the scenes. So you maintain the Medicare A and B card, but Aetna is the one that you are going to take to your doctor or your hospital. So that is the simpler situation, signing up for Trail, where you're the only one, or whoever is going on Trail is already on Medicare. So then what do you do if there are going to be multiple people on the program? Most likely it's a TRS member and their spouse, and they are not eligible for Medicare at the same time. That is very common. So you have two people on there. One is eligible for Medicare, but the other is not. So the first person eligible for Medicare is going to follow exactly the same process. They're going to sign up for Medicare Parts A and B through ssa.gov, send a copy of the Medicare card to TRS. But in this case, you will remain on TRIP, but move to the Medicare primary column. And the person that is not yet Medicare eligible will stay on TRIP in the 26 to 64 column. So that kind of looks like this. We have this not Medicare primary 26 to 64. And this last column says Medicare primary for all ages. So let's say that you, the TRS member, are the one that is turning 65 first and going on Medicare. So you've been over here in the 26 to 64. You'll give us a copy of the Medicare card, and then the premium will drop to the $130 a month or $309 a month, depending on which program you're on. It will drop to that premium, and your spouse will stay in the 26 to 64 category until they turn 65. Conversely, if you are the younger one, you will stay in the 26 to 64 category. Your spouse would come over to the $450 a month or $619 a month, depending on which program you're on. And that would be technically a Medicare supplement while they're waiting for you to turn 65 so that you can then go on Trail. So this is the second piece of this. Multiple people on TRIP. One was eligible for Medicare first, and the other one is now eligible. So now both of you are eligible for Trail. The person that is last Medicare eligible is going to sign up for Medicare A and B, just like everyone else, and then both can move to the Trail or Medicare Advantage program together. And at this point, you would contact My Benefits Service Center and officially opt for the Trail program. In this scenario here, where you had one person eligible first, you don't need to contact My Benefits Service Center because you're going to stay on the TRIP program and you'll just move right over to that Medicare primary premium. But once you're both on Trail, you are going to let My Benefits Service Center know, okay, we're both on Medicare. We do want to opt for the Trail program. And then both of you will be on this chart where the TRS member is $216 a month and a dependent is $649 a month. So again, dental and vision are not part of either TRIP or Trail. TRIP and Trail are medical and prescription drug, but do not include dental and vision. So you could get that in a number of different places. If you're recently retired, you may be able to get that through COBRA with your district. You also could contact retired teacher organizations. They may offer something, and if they do, TRS can probably withhold the premium for that from your pension. It doesn't become part of the TRS insurance, but we can withhold the premium on behalf of that program for you. And then, of course, there are various programs out in the retail market that you could pick as well. So there are a few questions that very often come up on this. So let's cover these quickly. What happens if you are on TRIP, but you don't want to go to Trail when you become Medicare eligible? Well, what will happen is if you and anybody that is on TRIP become Medicare eligible, your TRIP coverage will automatically cancel once you become eligible for Medicare. And then if you do not want to enroll in Trail, which would mean you want to get some other type of insurance in the retail market, that is fine. You don't need to do anything at all. Your insurance will automatically cancel when you or the younger of the two of you, if you have multiple people on there, become Medicare eligible, it will automatically cancel. If you are joining TRIP due to the termination of other coverage, what do you need to do? Well, we have what's called a TRIP participation form. You would contact TRS to get this form. We'll print that off for you and mail it or email it to you. And you will complete that form and return it to us along with a copy of the termination letter from whatever insurance you're being canceled from. Anybody that is going to go onto the TRIP program, the termination letter does need to indicate the names of all the people that are coming onto TRIP so that you can sign up. When you become Medicare eligible, can you stay on TRIP if you're happy with it? Actually, if you are eligible for Medicare, you do need to move to the Trail program. The one exception would be the situation where there's people of different ages, but as soon as everybody is eligible for Medicare, the only option for you is to move to the Trail program. You cannot stay on TRIP. What if I'm someone that never paid into Medicare and I'm not eligible? Well, in that case, you would stay on the TRIP program and you would be in the not Medicare primary 65 or older column of premiums. So that is this second to last column here, the HMO being $450 a month, PPO being $1172. The only time this comes into play is when we have retirees that did not pay into Medicare and are not eligible for it. Not as common these days, but it could happen. If I am a TRS member, my spouse goes on Medicare first, do they have to take the TRS Medicare supplement or can they get that somewhere else? Actually, your spouse can get a Medicare supplement elsewhere out in the retail market if they like. And If they do that, when you become eligible for trail, they can join you on trail at that time. They cannot go on trail if you're not eligible yet, but they can join you on trail when you are Medicare eligible yourself. What if my doctor or hospital says they will not accept the Medicare Advantage plan from Aetna? We do occasionally run into this. If the providers accept Medicare, then our TRS members can seek services from that facility. They do not need to be in the Aetna network. So the Aetna plan does, it pays providers who contract with Medicare regardless of their Aetna affiliation. Usually, they will go ahead and as a courtesy, they will bill Medicare for you. But if they don't, then you can submit the bill to Aetna directly and send them an itemized bill, and they will take care of it from there. So as a courtesy, most providers will go ahead and do this, but if they don't, you can send the bill to Aetna and it will work that way. As long as the provider that you are seeing, either the doctor or the hospital, as long as they do accept Medicare, this insurance will work. Do I need to sign up for Medicare Part D? That is a prescription drug. You do not sign up for Part D. Both TRIP and Trail include both Medicare and prescription drug. Again, neither includes vision or dental, but they do include prescription drug. So then how do I know if my medications will be covered? You would actually, the formulary list would fall to the insurance company. So on the TRIP brochure in any of the brochures that we have, you would look up a phone number basically for the insurance company that you have chosen, and you would need to call them and see which category different prescriptions fall into. And how do you check and see if your doctor's on a particular program? What you could do, again, is go to the links that are available. So on any of our programs, if you look in the brochure, the companies that are available in the county that you live in, there are live links there online. You can just click on those and go in and check to see if the doctor or the hospital that you want to use is in the network. If it's an open access, you can see if they're a tier 1, 2, or 3 doctor, so you can get a lot of direction by looking up the specific provider on the website. So if you have additional questions on this, there are a number of ways that you can get in touch with us. First off, you can call TRS at our regular number, 877-927-5877. And the member services people can either answer your question or direct you where you need to ask your question. If it's something specific about what things are covered or enrollment or something like that, then they will give you the phone numbers of where you're going to call for that. But you can get a start at the TRS number. You can also send an email. Members at trsil.org. That is, all the emails that come in there are handled by a TRS benefits counselor. So they will give you a response in 1 to 2 days. And again, sometimes it's directing you somewhere else, but at least you'll know who it is that you need to contact. In this situation with health insurance, My Benefits Service Center is really a key for you. The phone number there is 844-251-1777. And what would happen there is once you have enrolled in TRIP, then you would choose a plan, which insurance you wanted to take by calling My Benefits Service Center. If you want to add or delete a dependent, you would contact them. And if you've decided to get insurance elsewhere, if you want to cancel, you would call My Benefits Service Center as well. So once TRS has done our job of being sure you have the service credit in order to qualify, and we've processed that TRIP participation form for you, then making additional changes or adding and deleting people, that type of thing, is going to fall to my benefits service center, and you would reach out to them. On the right-hand side here, we have various ways that you can get in touch with us. The TRS website is always a good place to start to find some information and contact information and such. Facebook and Twitter are going to be up to date on things that have changed. And the YouTube channel is a great resource. That is where you'll find recordings of all the different webinars that we do. So you can go right on the TRS website, you can click on this YouTube channel or the TRS website, and at the bottom of that, it will say view videos, and you can go through and choose whatever it is that you would like to listen to. So thank you for joining us to hear about the TRIP and TRAIL programs. Do not hesitate to reach out to us if you need further direction on how to sign up or how to make changes. Thank you.